Hello, everyone. Welcome to another episode of Vega Insights. My name is Luke Bideaux, and I'm the president and CEO of Vega Imaging Informatics. With me today is Tom Kern. Tom is currently the team lead for IT informatics for a nonprofit organization in the healthcare space. Tom also serves with me on the American Board of Imaging Informatics as a Board of Trustee member. Tom, great to have you here with us today.
Oh, thank you, Luke. It's great to be here.
All right. So we are going to talk a little bit about careers in imaging informatics, share a little bit about our careers and our stories, provide some guidance for aspiring imaging informatics professionals or those that are already in the field, what they could do to grow in their careers, and just hopefully share some lessons learned here from our experiences. So, Tom, I'd love to hear a little bit about your career story, how you got started in this field, and kind of what's happened to you so far in your career.
Yeah, I have been in healthcare IT almost 25 years. This summer will be 25 years, and I got involved with imaging informatics in 2003. We're getting the hospital I was working at the time was getting a new PAC system, and the director said, "Yeah, it'll be 100% of your job for like 6 months, and then maybe like 20% of your job." That was a lie. And it became my career focus. So I've been focused on radiology and cardiology imaging systems since then. Shortly after we went live at that facility, we had some changes in. So I kind of started looking around and I found a new job in Phoenix. I was living in rural Arizona at the time. And then I spent the next 15 years working for a couple of hospitals in Phoenix, growing from a PACS administrator to a PACS team lead to an ancillary applications team lead to a supervisor. And then I had a colleague call me and say, "Hey, I've got a position opened up here in Colorado. You ever thought about leaving Arizona?" And I said, "Sure." 2020, just as the world was going through a lot of stuff in the spring of 2020, it picked up and moved to Colorado to start a new chapter in my career and to implement an enterprise imaging platform for a pediatric children's hospital. That was quite the experience. And then a few years into that journey and really starting to build, I got an opportunity to do a complete career shift and join the nonprofit I'm with now, and be focused less on the clinical side, more on AI and some of the groundwork doing there and helping to build the AI um, data into these platforms. So that's where I'm at today in a very brief nutshell for the last 22 years in imaging informatics.
And could you tell me a little bit about your education? Is it true you started with the bachelor's program and then later on in your life you went back to school? Or tell me a little bit
Yes.
about that.
So I got a bachelor's in business administration and IT in 2001 from Northern Arizona University. So just a small commuter school in Arizona. And at that time, they were training us to be COBOL engineers, which is which was interesting. And I got into healthcare very much by accident. It was literally the first place that offered me a job, and I went, "Yeah, this is cool," and just ended up really liked the pace, liked the way the technology was changing, especially back then in the early 2000s. Um, just so much to learn because healthcare was still, even then, a couple of years behind the curve of everyone else. Flash forward to 2016, 2017, and I'm a supervisor at you know, a hospital in Phoenix. And I go, you know, I, I've gone about as far as I can in my career. And I was kind of looking at some options. I was hitting that mid-career point of, do I stick here or do I pivot to something else? And I took advantage of the educational opportunities my organization provided. And I did an online degree in cybersecurity operations. So I have a master's degree from Grand Canyon University in cybersecurity, which is worked really well for helping to architect imaging systems in my previous roles, but also to be a little bit more mindful in how those systems are architected versus just making it work. So that's
Mhm.
been and really kind of brought some other perspectives outside of healthcare into my way of thinking at a kind of at a very mid career point, and helped to reshape a couple of long held beliefs that I'd had around how things should work.
Yeah, that's interesting. I mean, kudos to you for going back to school, after all those years of being out of it. It's hard for many people to do. Be hard for me to do to think about that. Would you say that going back and getting your master's was like a key component to your career growth, or, was it other things primarily?
You know, I at the time I thought it was gonna be, and in the almost 10 years since I started that, it's been less of a factor than I thought. Really, my career growth, I really attributed to being involved in a lot of industry things and doing volunteer work with HIMSS, or not with HIMSS, with IHE, SIM, ABBY, being involved with those organizations and making connections outside of my organization. The job in Colorado that I took at the beginning of 2020, that was from a colleague that I work with closely in SIM, and we've maintained contact throughout the years. And when a job opened up, I was, short list of people that she thought to give a call to.
Yeah, that's interesting. And tell me a little bit about your certifications, because you have your SIP, right? Your
Yes.
CIIP. When did you get that in relation to your career growth?
I got it pretty early on. I took the CIIP exam in Providence in the in-person exam on bubble paper, so it was the first one. So, I have a distinct memory of sitting next to someone who was complaining about they have computer exams for a reason. Why are we doing this on bubble paper? But it was very early on, and it was really I did it on a lark. It was my project manager at the time and the PACS administrator from our partner organization for the physicians were both, clinical. And they're like, oh, yeah, this would be very cool to take. And they were doing it at SIM. And I'm like, sure, I'll take it. You know, all we had was a test content outline and like a hope and a prayer. And so I was like, uh, and so at Sim, a lot of times you spend a lot. There's a fair bit of downtime at Sim where you can socialize with your colleagues. So we ended
Mhm.
up sitting in a bar the day before the exam. My project manager and the administrator from the other organization were teaching me clinical, lateral, what is it, chest to eight, anterior, posterior, all those terms. And I'm sitting there teaching them, okay, so this is a NIC, this is a MAC address, this is a file system. And like we were doing that kind of collaboration. And then that was the most frustrating part about that is all three of us walked out of that exam going, what on earth was that exam? And then you didn't get your results right away like you do today. And so like it was, I think like a month later, I got an email saying, congratulations, you passed. Here's your certification number. So I've got a 2-digit certification number, which I'm very proud of. And anyone who's got a certification number in any sort should be very proud of that. That the CIIP exam, I've seen it evolve, and it has just been amazing. And Luke, have you worked with the exam committee at all, or any of the question writing for the IIP exam?
I have not on that end of it, but I have been involved on the sim side with what they call defining the learning objectives, which similar to sort of defining the test content outline on the Abby side, and actually sim sort of mirrors the test content outline in their learning objectives. But yeah, I kind of I learned a lot with that whole initiative to define the objectives that the organization is going to teach on and train on and test on and everything.
Yeah, and on the other side, like when we're sitting in the exam committee and we're looking at these questions, what are we trying to get out of these questions? So I imagine the conversations are very similar, just framed slightly differently. So okay.
Yeah, well, you've had a lot of career growth and you've done things, such as going out there and getting your master's, getting certified. And I'm guessing a lot of people watching, maybe various places in their career journey, wondering where they should prioritize their time and efforts. Should it be going back to school, go for a more advanced degree, go try to get certified, or maybe just study independently on things that they think would help them grow in their career. What sort of advice would you have for those types of professionals that are kind of torn between going back for more school or certification or other things? How would you guide them in that way?
That's a really good question because that's not a one size fits all answer. You know, Off the top of my head, you can never go wrong with education, whether it's self study, getting a more advanced degree, or even getting a certificate. You can never go wrong with that. If you know to grow your career, that's a conversation. That's a conversation you need to have with yourself. Where do you want to go? Where do you want to be? Truly, where do you want to be in 5 years, 10 years, 15 years? Asking people like yourself, like me, like name drop any number of people in your organization that you look up to. Hey, this is where I want to go. How do you think I can get there? Or, you're where I want to be. How did you get here? And have those conversations and find a mentor. I had a mentor, and she didn't know she was a mentor very early in my career, that pushed me out of my comfort zone. And to this day, I still owe so much to her that, if like one of those career questions, actually, I've texted her and go, "Hey, Vic, I got a question for you. Can I give you a call at some point?" And we just chat for a couple of minutes and, kind of hash it out and take it from there.
Yeah. Now having a mentor, that's just so valuable. And yeah, I echo that guidance. If you can find somebody that can put you on the right track, is very important. When I started out, I went through a radiography program at the Mayo Clinic, and I did some shadowing. I just made it happen. They didn't really have a internship program for imaging informatics or anything like that. And they still, not very many places do, but I was able to work out a plan with them to just be able to shadow the PACS administrators. They gave me a lot of guidance. One of the things was you need to get on the path to certification. And definitely if you ever wanted to be a PACS admin here, you need that. And so very early on, I knew that I needed to get on the path to certification if I wanted to grow. But beyond that, as I started to get into the field more, it really wasn't my employers that were pushing for certification. I think there's still a lot of gaps in knowledge about the certification, the value of it, the importance of it. So I pushed myself because I knew it was something that I wanted to get for growth, but it wasn't really my employers that were pushing me to get certified. I think it helped me a lot, maybe in ways I wasn't expecting, but um, thankful for the mentors early on that advised me to do that, made me aware of it and so forth. So
Yeah.
yeah. But now I've been fortunate to have grown in my career and be in a place where I feel like I can be the mentor to others. And I do get asked pretty frequently from aspiring IIPs, you know, for guidance and things like that. And I thought we would just kind of bring that topic up and discuss it here. So, one of the things that I see is very important if you're before you start with this initiative to try to grow in your career is, just understand the field, understand the roles that are available in the field. I think there's many people that have a misguided understanding of the field of imaging informatics. Their vision of it is only what they've been exposed to. So if they've worked as a tax admin or something at a hospital, they're in that world day after day, and that's what they think imaging informatics is. Others maybe have always worked on the vendor side, and so I think understanding that, hey, there are many roles on the vendor side, the provider side, also like with your organization, nonprofit, my company, consulting. There's a lot of different paths out there. And so I know, at least from my experience, I don't think I had that broad of an understanding when I first set out to be, PACS admin or imaging informatics professional. I learned as I went along about these newer things. And had I known about the broader scope of the field, maybe I would have done things a little differently. I don't know. But, was that your experience too, Tom? Like when you started off, has your vision of the field changed over time?
Absolutely. And you talk about, the roles on the vendor side and then the various roles within the nonprofit space where I'm living or we're in the clinical space where I previously lived. When we started, it was just X-ray imaging and then very quickly cardiology because it's a lot of the same equipment, a lot of the same people. The last healthcare system I left, we were working on getting visible light integrated across the board into our EMR and having a single image viewer. And I had a conversation with my CIO because our providers on the floors were taking pictures on their iPhone of ultrasound focus machines because of internal secure internal process failures. What I will say it was is why they weren't being sent to the PACs, and I'm just going to leave it at that. That's another podcast. CIO came to me and chief medical officer came to the CIO. CIO came to me and said, how do we fix this? I'm like, give me a week. Let me put something together. So, I put together this full plan of, everything lives at the EMR. The imaging is this other layer and it's a plug-in architecture. And, we've all seen this chart 1,000 times before. But the first time I saw that chart, the light went off in my head of, oh, this is how we integrate, dermatology. This is how we integrate wound care. And this is how we integrate pathology. Because I saw all those things when I was working in Phoenix, but they still have the paper chart, but everything, you can't print an x-ray anymore, but we're still handing out physical printed out pieces of paper for pathology. And that would have been 2012, 2013 timeframe. And I heard about it then too. Why can't I have my X-ray? So yeah, the growth has been really interesting, and the dynamics of that growth and how it's changed perceptions has also been really interesting to navigate.
Yeah. Oh, it's always changing. And I think that's why, again, it's just so important to do your research on, the whole field and the roles that are out there. It could change your entire path that you put yourself on. And then, once you've sort of researched the field and thought about the different roles that are out there and what aligns with your interests and skill set, I would say at that point is a good time to consider what level of education you're going to need, what type of certifications you might need to get to the level that you want to get to. And so, I think it's just so important to have goals in your career. I think a lot of people don't do that. They might say, "Yeah, I want to grow," but do you have specific goals in mind? Do you have specific roles that you want to get to with specific plans on how you're going to get there? I don't think a lot of people do that. And, it's really a shame because, you know, if you don't have organized plans to getting to a goal, you're just kind of drifting along and the waves could push you any direction. So definitely want to just throw that guidance out there to really analyze what's available. One resource that's great for analyzing the different roles in imaging informatics is what they call the career matrix that sim has released. I think that was an initiative led by Don Dennison, and it's free for sim members. If you're a sim member out there, I'd encourage you to go on to the website, look for the career matrix. I think it's under the resources tab on their website. You can download that for free. If you're not a sim member, it might be a good reason to think about becoming a member because it can help you sort of plan out your career and not just understand the roles that are available, but also what sort of knowledge and skill set you need to achieve some of those roles and be able to grow in those areas. Highly encourage everyone to check that out if you haven't. And then, social media these days, Tom. I mean, I don't know how active you are on it. I'm somewhat active on it. Tell me about, if are there any resources that you've come across online or social media that you've felt to be helpful in your career growth?
Well, to an extent, surprisingly, Reddit has a fairly active PAX admin subreddit, and it's focused primarily on radiology, but there's a lot of good discussion in there and a lot of people asking the question that you're asking, how do I get to the next step of my career? Or how do I get into the career? And the thing you see in there constantly is people are giving the same bullet points of advice of, you know, start is get involved in whether it be in your organization or in your department or wherever. The other thing I've really used quite extensively is LinkedIn. And that's really more to build my network. And to the extent of if I see someone give a really excellent talk at a conference, I'll look them up on LinkedIn and I'll just send them a note and say, hey, I saw your talk on, you know, AI and, something AI. 'Cause that's all we talk about these days. Hey, make that connection. And, you know, A, it puts you in contact. B, that might lead to a conversation of, possibly having a mentor, possibly getting, learning something. But again, education's never a bad thing. Facebook, there used to be some pretty good groups out on Facebook. I don't do Facebook nearly as much as I used to. Um, do I mean, there are physician groups on Facebook that are very involved. I actually have a story about that. That's also another podcast, but they're out there. So yeah, absolutely. If those communities are out there, um, it's again that connection and learning from those around you. And if somebody else has already made the mistake of integrating the EMR one way when it was really better to do it another way, learn from them and try not to go down that same path.
Yeah, that's the nice thing about like with LinkedIn or Facebook. Once you get connected, then you're going to start to see all their posts and you can learn from them, even if you're not meeting them in person or calls. You still can learn from them through what they're posting and so forth. And so, yeah, I think that's always good advice. And you mentioned getting involved. I like to highlight how important it can be to get involved within your own organization. So you might have your role and the handful of people that you interact with on a daily basis, but I guess I can speak to how important it was for me when I first started out at working at a PAX company to learn from the other departments within the company, um, being able to ask them questions, and just learn as much as I did from these other departments. Would you echo that type of experience or, what are your thoughts on the importance of trying to get involved within your organization?
Absolutely. So in a previous organization back in Phoenix, I started as an analyst and got promoted to a senior analyst and then became an interim manager. And along the path as a senior analyst, I started supervising all the ancillary applications, which was basically anything that was medical but not the EMR, all fell under my purview. And as a direct result of working with all of that and still doing my day job as an imaging admin, got the interim manager position. The first person I brought into imaging informatics, she was a tech shift lead in the X-ray department, and she hurt her back, and so she was on light duty and ended up doing just cleanup work in the packs for us. And we had a risk go live. We're going live with a new risk, and we 4 o'clock in the afternoon. We've had this problem following us all day. In she comes. She goes, "Oh, there's your problem right there, there, and there." Because she had been listening to all of the meetings, and we looked at it, and it was close to the Three Stooges, palm on forehead as you could get moment in that room. All three of us looked at each other and went nuts, and we sent it up the chain to the vendor. And sure enough, within 45 minutes, the problem was gone. And then, it was kind of smooth sailing from there. But had the presence of mind to pay attention while she was doing her work and asking those questions, and she was one that was always asking questions about, hey, what's the logic behind X, Y, and Z, and was a known quantity. So when the position came open, I called her and said, hey, you should apply for this position. Oh, I'm not qualified. No, no, you should apply for this position. So, um, and again, build your network.
Yeah. No, I think I can, a lot of similar examples come to mind for me as well. People that they do what they're doing well, but then they go that extra mile and try to expand their knowledge and step outside of their comfort zone. And that's really what you have to do if you want to grow in your career. You always a little bit outside of your comfort zone and leaning on the expertise of others to try to get to their level. So that's number one is just look within your organization, the people you have around you. How can you learn from them and grow through them? What about outside of the organization? Tell me about some of the societies or other nonprofits that are out there that you've found helpful in your career growth or you've seen others benefit from.
Top of mind for me is probably going to be SIM, just because it's education focused, but I've presented at SIM multiple times and been involved with them. But delivering that continuing education content, you have to go research that to deliver it. That helps to, oh, these are the new ideas coming down the pipe. IHE, and particularly the IHE Connectathon for North America, if you can get in as a monitor there, I learned more doing that conference for a couple of years as a Connectathon monitor to make me a better HL7 and DICOM person than anything else in my career. And I also made a couple of key connections that comes, 5, 6, 7 years later, when a job came open at my current nonprofit, one of the hiring managers saw my name and went, hey, I saw your name. Is that you? It is. And Abby has been very helpful volunteering. Because, like I said before, I was on the exam committee and I'm currently on the board of trustees of getting that larger, big view of getting out of my hole. So I've been very focused in community health, very focused in pediatric research in my career. So that, I think everyone has the big name EMR. Everyone has one of the big name PACS systems. Everyone has the big name, Image Exchange. And then to be sitting in an exam committee meeting and talking with, a peer, and he's like, and he's a vendor peer, and he goes, yeah, we have a 2-year backlog on RIS system installs because people aren't using, big name EMR for the RIS system. And that was another light bulb moment of, not everyone's gone to, the best path. Some have gone, with best of breed approach. And in getting that perspective of the larger industry, which, I can then bring back and go, hey, this is how we should tackle this problem of having doctors taking pictures on focus machines with their iPhones to send them around versus everything in the EMR. By the way,
Yeah.
everything should always be in the EMR. Just want to make that very clear.
Mm, Tom, I want to go back to that IHE Connectathon point that you made. You've had some experience as a moderator for that. Is that something that anybody can do, or do you need to get selected to be a moderator? How does that process work?
So I I had to submit an application the first time, and it was a full CV. And they, based upon my CV, they said, okay, you'd be really good with radiology workflow. And the person who'd done radiology workflow previously was moving to fire. So this would have been 2015, 2016 timeframe. It ended up, it was 1.5 people for radiology workflow that year. So I took that one, and then they had the half. And next year it came up, we need a radiology workflow person for the Connectathon monitor. Tom, are you available? I am. Cool. And then, kind of got in that way. it was always kind of an email all call, and just kind of in the way I got connected with that is my project manager at the one I was sitting in the bar with teaching terms to saw the advertisement in some journal publication. She goes, "Huh, I think you'd be pretty good at this." And that was in like 2014, and I kind of kept an eye on it. And when I saw an all call, I'm like, "Yeah." And I threw my hat in the ring, and away it went.
Interesting. Yeah. So if you're not going to go to the Connectathon as a moderator, but you just want to go and learn as much as you can, do they have a pathway for somebody like that to just go and observe, or how does that work?
When I was doing it, and this was in 2016 through 2021 was when I was a Connectathon monitor. When I was doing it, it was in person. They did have a like a 2-day track, and it wasn't just a Connectathon. It was a bunch of things. At that time, the IHE Connectathon for North America was in part with hymns at the Cleveland Learning Center. Don't know if it was IHE or hymns that specifically did that, but there was definitely people coming through, and they were learning and talking with the vendors on, okay, so what are you doing and how's this all connecting? And then they would talk to there was a like I don't want to call them a chief monitor, but like a preceptor, for lack of a better term. And they would talk to that preceptor, and kind of they would describe what was going on with the various Connectathon monitors and what they were actually monitoring and taking a look at.
Yeah, I hear so many good things about Connectathons. I've never been to it. Tell us a little bit more about why those Connectathons are so enlightening when it comes to DICOM and HL7. I mean, is it because you're able to inspect the traffic at such a detailed level and work with both sides of the systems that are being connected? Or just tell me a little bit more about that.
So actually that's a lot of it is you're seeing very much the detail level of the HL7 and DICOM and the message traffic as it goes through. But also on the other side, there's a spec document for every workflow that they're testing. And for those who aren't familiar, IHE stands for interconnect or integrating the healthcare enterprise. And the basic thesis is every action should be repeatable, and you have action producing an output that is then fed to another actor. And so you have systems that are filling various actor roles across the enterprise. So you'll have a scheduling system actor, you'll have a transcription system actor, reporting is what it's actually called. Image view, image display are two separate actors. And having to slice and dice the nuances of difference between image display and image view is a very interesting needle because, to the layperson, oh, that's the same thing. To an informatics professional, image display is just, okay, it's up on the web. They don't need to do a whole heck of a lot of zoom in, zoom out. Image display is, or image view rather, is the radiologist going in and actually manipulating the images and doing their read on the images. Getting into that nitty gritty detail, you can see in the real world, this won't work because XYZ. And I have a specific story, again, another podcast of working with a vendor and going, this won't work because when you do this, this, and this, it's going to break this back up here. You need to do this. And they made it work there at the Connectathon. There was a group of students, they were developing something for use in rural healthcare in their home country. And they took that information back. And then he showed up the next year. They remembered me and they're like, we took your advice. And me as a Connectathon monitor, I went, cool. I can't wait to see what you did. And then they did it and they did it beautifully. Having that level of work and then working with the big name EMRs, going, seeing the work that they're doing behind the scenes. I have very strong opinions about about how those EMRs are architected. But when you get under the hood and you talk to their developers and you see the tech stacks that they're working with, um, it makes you appreciate the hard work these folks are doing behind the scenes and how truly stable these systems are. And that's probably also yet another podcast.
Yeah. Well, thanks for sharing all that. Maybe someday I'll have the opportunity to go to one of those, but I've heard nothing but good things. Um, So we've talked a lot about ideas for guidance for professionals that want to grow. I think there's one observation I have that many people get pigeonholed into their own company. They they look at the path that their company has for growth kind of as their career path when really, you know, your company does not define you as a professional and it doesn't define your growth potential, right? Um, and if you can get involved in some of the things that we've talked about and create a career roadmap for yourself that may or may not fit within the company that you're currently at, that's really how you're going to achieve your full career potential. And then beyond that, um, I think many people that are in the field of imaging informatics are here because they want to make a difference. They want a career that's fulfilling where they can see they're having a positive impact on the quality of patient care that's being delivered, solving problems. One of the things that I've always enjoyed about this field is I look at myself and as one person, there's only so much I can do. When I was, started off as a radiologic technologist, there's only so many patients you can care for in a given day. And as I moved into more advanced roles in imaging informatics, I've been able to help so many doctors and so many other healthcare professionals so that they can do a better job with all the patients that they're able to care for. And I feel like I've been able to make a bigger impact in this field because I've been able to help so many healthcare professionals. So, what I'm getting at is you shouldn't just think of your career as climbing up a ladder and trying to make as much money as you possibly can, but looking at it from the lens of how can I make the biggest impact on patient care? What are my skills that I can bring to the table and do something in this world that can really make the biggest impact? I don't know, Tom, do you kind of share some of that sentiment about why you're in this field to begin with and what keeps you in the field? Because you have your degree in cybersecurity. There's a lot of industries you could go with that. Uh, Tell me a little bit about why you feel like imaging informatics is a good place for you.
You know, I think you nailed it on the head when you said, trying to help your community. Many so again, the project manager again, pro- we were working on a forklift upgrade of the PAC system, and we're having a discussion and kind of like what you and I are having right now. And she basically told me that this was going to be our last project together. She was going to be, retiring and going into the whole thing. I'm like, well, and she started out as an ultrasound tech and got into project management. Like, what brought you here? She goes, because I can impact more patients with tax than I could ever do it as a rad director, as an ultrasound tech. And so when we're architecting that system, I kind of took a step back and went, oh, I never thought about it like that before. Like, I can serve this entire community with this system. And in my next role with being a teleradiology supervisor, you know, just expanding the scope. And, and so when I look at these systems, I don't see, you know, a work list and x-rays and patients. Like, those names have a living, breathing person behind them. And when you work at a pediatric facility, it's, I don't have kids, but I've got nieces and nephews that I love dearly. And when they're in the hospital, like, I'm a wreck. And never mind mom and dad, like, I'm a wreck. But like, this is somebody's worst day if they're in the ED and they're at a pediatric hospital. You have to do everything in your power to make sure that that worst day is just a blip on the road and not something that they remember. But yeah, in what it comes down to is I make a difference with imaging informatics and making a difference at a national scale. And yeah, I could probably make more money in cybersecurity, but the honest truth is it doesn't interest me nearly to the level of imaging informatics because it's humans and it's about taking care of my fellow humans at the end of the day. And that's what keeps me here and that's what keeps me going.
Yeah, that's great. I think it's a great way to wrap up. Just you know, sharing our firsthand experiences, being an encouragement to others. That if you have a desire to really make a big impact on the state of healthcare, imaging informatics can be a good career for you, and there's so much potential. I think Tom would agree. The need for more skilled imaging informatics is higher than ever, and we both want to encourage you to consider this as a career path and consider working hard to reach your full potential in this field. Think we can wrap up the episode from here, but thank you all for watching, and just keep in mind that there are many professionals out there that are excited to help you on your career journey. Please don't hesitate to reach out to myself here at Vega Imaging Informatics, and Tom Kern and many others out there that are anxious to provide guidance and help those that are looking to reach their full career potential. So thanks everyone, and have a great day.